Now, I wanted to ask you if you bought into the concept, maybe you heard of New Germanic medicine that basically states an illness begins in the mind and then the body follows. And that's where a lot of this starts, even when you look at cancer. Dr. Hammer's work, who started New Germanic medicine, basically stated there was some emotional trigger in there. There was something in the mind that happened, and a trauma, usually a death, some kind of someone in the family loss, or some kind of real trauma to the mind that then resulted in a biochemical action later on. And he actually showed a lot of brain, scans and all these things and correlated that. Do you buy into that concept?
I think that is so fascinating. Absolutely. And it's interesting because this has taken a long time for me to really digest, and ultimately I think that it was impeding my healing. There's so much patient shame when you become so ill. And I'll speak to my experience. I carried so much guilt and shame for allowing this to happen to me. This is how I internalized it. Allowing myself to be misdiagnosed, allowing myself to take these medications, allowing myself to have addictive tendencies that brought me into this whole mess to begin with, and to seek the misdiagnosis. It's not, I so frequently would be discouraged when I was told, your experience is psychosomatic, it's in your head. And the reality is, like, psychosomatic is I do believe, like, absolutely, it does start in the mind. It can absolutely manifest from, our thoughts, from specific traumas. Absolutely. We're so sensitive and complex. But ultimately, again, it just speaks to how our unique system is digesting our unique experience, right? Like how our nervous system is interpreting what's happening to us. And the same thing can happen to two different people, and it can have completely different results, right? Like one person can be diseased as a result, and the other person, seemingly fine. So it's, what I have come to at the end of the day is finding the ability to surrender, and allowing myself as the patient to not necessarily need to know why things are happening initially, because I really feel that just kind of led me further away from the actual healing and coming back into homeostasis, where, again, this is a result of our medical system, but we're taught, specialists siloing your symptoms, defining you by a diagnosis, and really it is the ego to be so presumptuous that's like, oh, I know exactly what's happening to you, and we're going to operate, very strongly down that path in a way that can change your life forever. Where I have found the most success, and also the least resistance from our current system, is really just listening to what my body is trying to tell me with my symptoms, looking at it all as information, and then again, trusting my intuition to do what I think might work, and seeing if it does, and again, ultimately being an N of one study, and just witnessing, what is working for me, because what works for me today may very well change as well. And that's why, the necessity of the future of medicine must be personalized medicine, because not only are we all unique individual snowflakes, but we're constantly changing. And look at COVID as an example. Our individual needs have severely changed, and now so many people are seeking this very same broken system that I've been talking about, that never have struggled in this way before. And unfortunately, our system is not equipped to meet these demands currently, which is, at the same time, I say that But what I really truly feel is that we're witnessing the evolution of truly a new holistic paradigm that, we're seeing, like I said before, the validation of modalities like psychedelic science and breakthrough. When's the last time that you heard the term breakthrough in mental health, right? Like, to have any sort of effective treatment is needed now more than ever. And it's happening. It really is happening. And again, that's why, in my personal experience, to be able to then additionally bring a substance-free alternative and modality in combination with the appropriate substance-full versions, it's like, as long as we can continue to validate and meet the current medical system where it's at, practitioners, physicians, they're ready for change. They're ready to, stop harming their patients. They're hungry for, things like, even sound healing coming into the hospitals and frequency healing, things like that. I mean, it is a new era. And so I think it's really important for us to remain positive, of course, but to really witness that true change is happening.